Good morning, everyone. Bob Ravenscroft, Vice President for Advancement here at Bryan Health. We're here for our November 10th, 2020 media briefing, and welcome to our Facebook crowd as well. We'll start out with the statistics, and then we have a couple of advanced questions that I will cover, and then we're going to turn it over to John for some surgery news and a few other things. So let's start out with the statistics. Our midnight census was 530 patients. We have now administered 30,548 COVID-19 tests with 3,893 positive results, only 151 pending. Turnaround time remains good. The number of COVID-19 patients positive that are in the hospital is 102 inpatients. 34 of them are from Lancaster County. 68 of them are from outside of Lancaster County. Additionally, there are 13 other patients that are no longer infectious but still in the hospital, so that brings us to 115 patients total. There are an additional 8 patients in the hospital that are pending the results of their test as well. As far as where these patients are placed, 9 of them are still on ventilators. They are all from outside of Lancaster County. We have 13 patients in the ICU, 5 in the ICU that are no longer infectious, utilizing 18 of our ICU beds. So I think that covers the highlights of it. If you want breakdown of progressive care and general care units, just get in touch with us and we will share that information with you. The first message that I want to reinforce is just the message John shared last week, maybe the week before, about utilizing our urgent cares whenever possible. It just prevents any backlogs or unnecessary wait times in the ED. So that space can be reserved for those that really need ED. And we all know the type of things that distinguish urgent care versus ED usage and so forth. It is also going to be safer for our staff and for the patients coming. So we have 3 urgent care locations. There are other urgent care locations in the town. I just implore the community to use the services wisely. Frankly, I'd just like to say I think the local media has done a tremendous job with this, in my opinion. However, we have created some resources for our staff that have been present on the internet. We will be placing these on our website based on this request. And as you can see on the sign, there is a link there. We're leaning heavily on what the CDC says for this. So this link will take you directly to the CDC to give you some wonderful tips on how you can make the best of this very strange holiday season. The short answer is yes. We don't call them PPE extenders. We call them trained observers. We've had these in place really since the early stages of the pandemic. It was once a very good outlet for some of our clinical members of our team that had to be redeployed when surgeries backed off. It's staffed a little bit differently now. We've recently hired 9 additional ones. Why this is important is their role is really, I'd boil it down to the supervision of properly donning and doffing of PPE in our strictest isolation areas. It minimizes the unintentional harm that could come to our staff, patients, or others. And the reason is they are taking this stuff on and off all of the time as they're racing from one patient to another. And it's just a protection staff step to make sure that they are doing this safely. They're not letting anything forget as they cover all of this stuff. It's worked very well for us, and we see it's very important. So short answer is yes, we have trained observers, and that is what the Med Center is now calling PPE extenders that they just announced. Basically, I think in the simplest terms, it means they're no longer shedding the virus, but they're not stable enough to be just discharged to their home or perhaps a care center or wherever else that might be for them. They just don't have the convalescent care in place. It's a significant issue for hospital capacity that we're all facing, and I know that we're working on a lot of different options to try to alleviate it. Bottom line, if they are still in the hospital and no longer infectious, it's because they're not ready to be discharged somewhere. Some of them are quite ill, As far as the effects that impact these patients that are still in this category, even though they're no longer infectious, if they're still in our hospital or the ICU, you can assume it's something that we've all heard about, the long-term effects of COVID, where there's damage to the heart, lungs, brain, among other things. So I hope that gives you, the person who asked the question, some insight. We've been reporting that, a significant percentage is coming from outside of Lancaster County. So in November, so the first, 10 days of November, here's where our patients have come from. Lancaster, Adams, Atkinson, Buffalo, Clay, Dawson, Dodge, Franklin, Gage, Hamilton, Jefferson, Johnson, Kearney, Merrick, Montgomery, Nemaha, Odo, Ottawa, Platte, Richardson, Saline, Saunders, Scottsbluff, Seward, Thayer, Webster, and York counties. That's just November. From March 20 to the present day, we've treated patients from 57 Nebraska counties. And November 1, it's obviously the 27, November 1 to present, it's the 27 counties I just rattled off. The counties with the most prevalent inpatients at Bryan in November have been Lancaster, Jefferson, Merrick, Platte, Saline, Saunders, and Seward. All right, I think that covers the advanced questions. John has some news that we were dreading sharing with you, but it is time to share with you some surgery news and a few other things. John?
Thanks, Bob. I'm John Woodrich, CEO of Bryan Medical Center, and I have to start with this because it's so important, people. Masking, we've got to do it. We're trying to figure out the best way to get this communication out. Media has done a great job, but we're witnessing people that still just feel it's not appropriate to wear one. Please do so. I think you see by the numbers that Bob shared, it's stressing the system. Social distancing from folks. If you're not wearing a mask, please try to do that. Try to avoid confined areas, crowded areas. Washing your hands is really important in any type of close contact. So when you listen to these numbers and you go back a couple of weeks ago, we've more than doubled the number of inpatients that we have here, which has caused us now to basically postpone any elective surgery that has an overnight stay. And the purpose of that being is we need all of these available beds. So we get together with our medical staff and talk about this as we actually looked at our surge plan and said this is the right thing to do at this point in time. And we're going to keep that elective surgery schedule basically at bay now until November the 27th, and then we will make a determination if we will continue to open up additional rooms for surgical patients. What we will not do is cancel any surgery that has already been scheduled that is an elective. We feel that at this point in time, those people have prepared mentally for their surgeries. They've pre-authorized through their insurance company, so we feel that any case that is an elective that has already been scheduled, we will continue to do those cases. I do want to make it clear that any elective surgery that does not require a hospital bed, we will continue to do. This is the prudent thing for us to do as a healthcare organization. We said before to you that we would be transparent, we would manage this internally and make those decisions when they needed to be made. So we've communicated this to our medical staff, so if you have a specific surgeon, all the specialties are aware of it. If for some reason a person that this may be considered elective now and in the next couple of weeks or a week becomes more urgent, they will have the capability of doing those. We have a process that people will go through to assure that it is urgent at that point in time. We will look at those on a case-by-case basis. As Bob shared with you with these numbers, you know, about 2/3 of our inpatients are from outside of Lancaster County. We have always made a commitment to take care of Nebraska, and we will continue to do that into the future. But we know we need to do more education out in those rural areas because there's apparently a bigger spread occurring in those areas. So we're talking to the hospitals right now about what they can do. We're also having discussions about them maybe keeping less acuity patients in their community We could manage those via telemedicine. We're trying every effort to not fill up the entire hospital so that we can still handle those COVID patients that need to be an inpatient and just any of the emergent or urgent type things that happen from a day-to-day basis in our community. So we hope that people understand this. We will keep you informed as we continue to move forward and make these decisions. If for some reason we start to see a downturn, we could loosen it up a little, but everything that we've been witnessing isn't giving us that signal at this point in time. So also in the month of December, we already have cases scheduled. Those will not be canceled. We will be limiting the number of cases that people attempt to schedule in December because we don't want to see a lot of cases get scheduled and then we have to call people to say that we're too full to have those done. But we will keep the press and the community engaged in these decisions as they continue to be made.
Yeah, it is very sad it's become a political issue. I think you've seen our frustration. It should never have been a political issue. And yeah, we do think a mask mandate would help. We also understand that there are a lot of factors that go into political decisions that we don't want to even try to figure out. But yeah, there's evidence that the spread of cases less than 100,000 here in Lancaster and Lincoln is far, far below what's going on in some of our rural counties. So yes, we wish those would be employed, but that's not our decision to make. John, do you have anything to add there?
Yeah, I would just follow up that, you know, people that want to make this a political statement, really just look at the evidence behind this. I think we've proven that wearing masks stops the spread. And why do we have to wait for somebody to mandate us to wear a mask? Just look at the evidence. It's the right thing to do to protect yourself, but to also protect the people that you're with. So I don't need somebody to tell me to wear a mask. Go ahead and look at the evidence that's coming forward. Definitely there will be. I mean, we felt the effects of not doing those surgeries in late March, April, and part of May. And I think we were still playing a little catch up from those. And so what you have is you're going to have a long period of time where we're going to continue to be extremely busy. We have to stay very close to those patients whose surgeries are being postponed so that they don't become more urgent and emergent, and we get those done when they need to be completed. So yeah, I think it's going to definitely have an effect. I think it's great news. You know, we can't wait for them to get it out, get it distributed to folks. I think the logistics of doing that is going to be quite complicated and complex, but I know they've been working on that for months now, anticipating this day. So yeah, that's great news to come out and come forward to people.